Hi, Dr. Saxena here, and been talking on something called energetic medicine, and this was one of the big things which we understood after a quite long time. We believe something called biophysics, and when I talk about this word called biophysics, it means a lot. I just want to, whenever I tell, this is one of the slide which I'd like to show everyone. Thank you for turning off the cell phone, because what happens is that you are talking about uh, this particular stuff, and once you turn off your cell phone, you can always concentrate. So what exactly I mean to tell you about this thing term called energetic medicine. See, we believe that in energetic medicine there is no real separation between the mind, body, spirit and emotions, and we are talking about something like both vibrational medicine, bioenergetic medicine. All these are based on the things of biophysics, where we are talking about how the matter vibrates to precise frequency. And then when we have a resonance which happens, you are at ease. So there are a lot of things which as a kind of person we started looking into that. Before telling that, we I was like this, trying to look into all the adverse effects related to the electric and the magnetic fields, and I was always surrounded by the computers, to minimum one MacBook, one laptop. You have got a desktop as well. So somewhere we need to understand what is this thing called electro hypersensitivity which is happening. When I talk about this called electro hypersensitivity, I just want you to understand few things, which is electro hypersensitivity is difficult to diagnose, and we are slowly coming to terms with that. There is a lot of electromagnetic energy which is surrounding us, which is causing some detrimental effects to the human health. Scientific studies has shown this electrical pollution affects the children more than the adults and women, and it's a need of the hour to preserve, try to see that the children are not subjected to this particular kind of electromagnetic radiation. I had seen people handing the cell phones with a Wi-Fi, as well as not on the airplane mode, which we always insist our patients to follow. We tell our autism patients, ADHD patients, parents to see that they give the phone in the airplane mode, and to the contrary, we see, to our surprise, the parents, they feel themselves with, they tell us with the pride that this child is knows how to manage YouTube, every stuff and all. So really, this is a kind of concern, because having this particular gadget very close to your skull, which with this small infants are working out, it's a kind of, it's really, I somewhere I believe it this is to be absolutely, it's a condemnable act. This is my take, and I try to be, I try to talk about electro hypersensitivity a lot in a lot of colleges. I went to a lot of engineering colleges, spoke about that, but I was not able to. The thing which is required more is to, you should try to educate the parents, so that they should be careful in handling all these things to their kids. Schools are, we tried working with the schools. This is what we have to, we learn from how we are moving from this one, uh, examination of all mortality from all causes in 1930. Vital Statics provides evidence that the residential electrification was responsible for an epidemic of all diseases of the 20th century. The this is what the thing. The real surprise is that the cardiovascular disease, cancer, diabetes, and suicide seem to be strongly related to the residential electrification, and we need to really look at that because we have never, as doctors, I had never thought of these things unless once I look into this thing called energetic medicine, and how it's very scientific. It is science is now beginning to fully sense the subtle energies involved in the cells, which has got the electrode potential and all that. With the oscilloscope, we are able to know what is the trans membrane potential these things have got, and it's a simple way we try to look into this is really measuring the pH of the particular like I check pH of the urine, I try to pH check the pH of the saliva. This way we are able to understand what is the kind of situation our patient is in right now. So this is a simple thing which we always look into this issue called acid base balance, and it helps a lot in telling us where we are, or what where do we stand, because something acidic in the body is certainly not a good sign. The same with the more higher end of the basic alkalinity is also not good. Then you need to have something like neutral or something like a pH which has to be properly worked out, and it's all depends on this all pH and all that. It depends on the transmembrane potential of what are these electron donors and all that doing that. So this voltage is fundamentally important because the body is constantly regenerating itself. There are new cells which are coming up. You know about the skin, it regenerates every 3 weeks. Liver regenerates. There are a lot of so regeneration is possible because of this voltage gradient. See, the problem occurs when the cell runs out of voltage before healing is accomplished. Whenever this scenario occurs, there is a transmembrane potential. Sodium should go in, potassium should go out, and that is hampered, which causes the disease. It is because of the electromagnetic potential. This electromagnetic potential is healing voltage. We talk about that, and this has to be healing voltage is around minus 50 millivolts, about 50 millivolts, so that if we have something the voltage is low or something still. So nutrition without voltage doesn't work. In the same way, voltage without nutrition doesn't work. So you have to have both the things. So in all chronic diseases, what we have seen is there is a mismatch between these two particular stuffs. So this is one of the areas where we are trying to work it out. And yes, I had some reasons to say these are some of the simple things which start. This sort of the voltage. If you can understand what is this particular thing this doctor is talking about, if you can look into this, and this is what is that thing called biofield. This is Dr. Albert who has devised. There are a lot of biofields which emanate from the body, and in your body, and biofields are constant. They are not erratic. That is, you have a healthy kind of bio fields. This is one thing which I learned quite late, and biofields, this involves, it is one of the things which can protect you from external stresses. The bigger and stronger is, the more efficient and it's effective in resisting external stresses. This is what the other thing which I just want to share with you is this biofield can become damaged by your electropollution as well as biochemically, or from a poor diet, or from physical and emotional stresses. So yes, so friends, this is one thing which you have to be always look into that. this is called energy, and this biofield and all that. If you can understand this particular concept, if most what happens is that we keep telling that we give 40-50 supplements. We used to work it out in autism and all that. And what happens is that if the biofield or if the energy millivoltage of the cell is not proper transmembrane potential, so whatever you give, it doesn't get translated. So you need to have both. You need to have good voltage as well as good nutrition to work it out.